Most Nigerians are currently unable to access medical services in public hospitals due to the start of a national strike by resident doctors across the country following a labor dispute with the federal government. Amaka Ode tells us more.
The medical doctors are angered by the federal government's refusal to meet their demands and have now downed tools, with Nigerians bearing the brunt as hospitals become abandoned. This is the third national strike in less than 2 years after a series of unfruitful meetings with the government. The doctors insist that until all their demands are met, the strike will continue.
The government signed an MOU with us last year, and the government did not do anything explicit. Doctors have not eaten for 3 months and are still working.
Their demand include the payment of 4 months' salary arrears, payment of outstanding COVID-19 inducement allowances, and the implementation of an MOU signed last year. The government had last year announced that health workers would get 50% of basic salary as hazard allowances, but that is yet to be implemented.
Nothing has been done for any health worker as per the hazard allowance. Our hazard allowance has remained 5,000 since the time I started working. As an healthcare worker, you get exposed to patients who have hepatitis, who are infected with other ailments like HIV. You can't tell these patients you will not treat them.
Arise News spoke with some doctors. They back their union leaders and vowed to continue with the strike until their demands are met.
This is Akamini, a branch of the Nnamdi Azikiwe University Teaching Hospital that serves Ozobulu area, Nnewi, part of Nnewi, and surrounding. The truth is that the impact of the strike is so enormous, both on the residents that seek care in this center and also on the part of the doctor. With what we are having now, the doctors are hard hit by the economic situation of the country.
I came today for public appointment with the doctors. I noticed that they are on strike. And even from the men's side, I noticed that some doctors are not there. Even some sick people, many are crying there. Many attention are not being given to them. I noticed that you are like saying that some doctors are not being paid. What you are seeing here is unfair. At least, even if things are not working or road or whatever, let things that have to do with health, let them take it serious.
Many Nigerians whose only option remained the use of public hospitals want the authorities and health workers to urgently resolve the labor dispute.
My name is Esther Iheze. Please, government, do something about this strike so I can get my treatment. The doctor being on strike is not good for our health.
Nigeria has about 42,000 doctors catering to its more than 200 million people, with a yearly brain drain of at least 2,000 doctors who seek better opportunities abroad. Medical experts say the strike is avoidable and would further worsen the country's health indices. Amaka Ode, Arise News, Abuja.
Well, for more on this, we're joined by Dr. Okhuaihesuyi Uyilawa, the president of Nigerian Association of Resident Doctors. Sorry, I seem to have murdered your name there. It was a bit of a tongue twister.
Good evening, everyone.
Yes, it's never too difficult.
So nice to have
Okay,
you
let's
on this
start
night.
by asking you, yes, resident doctors are on strike, and you can see from one of the hospitals there that it's obvious Nigerians are suffering as a result of your strike. Help us understand, what are your grievances? If you could just itemize them 1, 2, 3, 4, 5, so that they are clear to Nigerians and even to people in government.
Especially the most immediate ones.
Thank you very much for the question. Yeah. It's painful we're back on this road again. For over a year, we signed a memorandum of understanding with the federal government. One, we have house officers, the interns that have not been paid 4 months' salary. Also, doctors and gift mix have not been paid their salaries. We lost 17 resident doctors to COVID-19, and we have lost some to Lassa fever and other infectious diseases. As it stands, no death in service insurance have been paid to their families or loved ones. Yeah. We are paid 5,000 naira for hazard allowance, why those in the upper chambers are paid 1.2 million naira for hardship allowance. That poses the question to the government, where do your priorities lie? Resident Training Fund, the fund made to train residents to become consultants, which is why most of our big men and politicians are traveling all over to the other worlds to seek for better health care. When you can give the best health care to Nigeria here, there are basic things in Nigeria that is not working. And it's high time government become more responsible and take their health in the country more seriously.
Now, you had a meeting with government, so the Labour Minister, I think yesterday, or was it today?
We finished it earlier as of this morning.
Of this morning. What was the outcome of that meeting? Because it's like the minister came out from that meeting pleading with the doctors not to go on strike, that you should consider the 80% of Nigerians who actually rely on you for health care.
I will, at this stage, say a big thank you to some of the responsible ones. I'll give an example of the Speaker of the House of Rep, Honorable Bajia Miller, Dr. Tanko Sununu, Dr. Ibrahim Yaya Oluregbe, and the Minister of Health and Labour. But however, it's back to the boards again. We have signed MOUs, now there's a modification, it's now MOA. And you are telling us that we should go call off a strike. You can't go call off a strike when people have not been paid 4 months of their salaries. Doctors that are supposed to be respected now take to arms and at the mercy of people around just to survive.
But the minister says that majority of your demands have actually been met, and more, is still going to be done. Is that not enough to assuage you?
We can do a countdown. How many house officers have been paid? Virtually none, less than 1/4. The hazard allowance has remained 5,000 naira for over 5 years. COVID-19 allowance was paid for 3 months and was not paid for the remaining 3 months. Insurance, death and service insurance that was supposed to be paid to loved ones for over a year have still not been paid. So where and what have we agreed on?
Okay, you mentioned that some people need commendation or should be appreciated. You mentioned the Speaker of the House of Rep, that's correct. You mentioned even the Minister of Labour and Productivity as Labour, and also the Minister of Health. Is that correct?
Yes.
Okay, having said that, and the Minister of Labour is saying that you've made progress with your conversation and you shouldn't let Nigerians suffer. My question will be this. What are the things that were in your MOU or MOA that have been signed off and delivered by government?
None.
So that we know, none at all.
At all.
So what progress are we talking about, if there is any progress?
We have been signing MOUs for over a decade now. Most times people blame doctors for going on a strike. A strike that is preventable, a strike that is avoidable. If a responsible government wants to do the needful, we don't need to go on a strike. Remuneration is not just why we should go on strikes. Global best practices. I can ask you a question. You can't find any hospital in Nigeria where they have the basic healthcare system. I'll take an example from here in Abuja. You go to National Hospital Abuja, they don't even have an MRI of their own. Instead, they're doing private partnership with other companies when they're supposed to be like a gold standard as hospitals in Nigeria. You go to UCH also, they don't have a functional MRI, functional CT scan. If somebody is being treated for cancer, you don't have a functional radiotherapy to treat them. But me and you that cannot afford to travel, where do our hope lie?
But doctors too have been accused of being the ones who don't want public health institutions to actually perform optimally because of private practice.
Thank you. If you are a doctor in a residency training, means you work around the clock. You won't be afforded that time opportunity to go on private practice. I'll give an example. I'm an orthopedic surgeon in training, and if I'm on call, I work throughout. We don't take a shift leave. We stay generally all through at the work. So what time do you think I will leave my work, go for private practice and come back? We have a brain drain in Nigeria when more like a brainstorm in Nigeria, where doctors, nurses, all health workers have been scavenged on by other places, Saudi Arabia, United Kingdom, US of A. And you can tell me that Nigerian doctors and health workers are one of the best in the world. And we know that we can deliver when we need to. So, for the interest of Nigerians, government must take up the responsibility to be more responsible.
So what is, if you have to make a final appeal now, what would it take for you to go back? Even if it is just a certain percentage of the issues.
All doctors that are owed their salaries should be paid. Hazard allowance for all health workers should be paid. And insurance must be made for all health workers. Thank you.
Okay, so I would actually like you to help us understand what exactly are the items on this MOU that you have with the federal government. And what is the government telling you on their side that is not allowing them to meet, you know, some of these your demands, especially the very important ones, insurance that you talk about, so many things. It's actually a long list, I must say.
That shows that there has been a decay in the system for over a long time. Because if you are able to face one at a time, we shouldn't be coming back again. For insurance, if I'm a doctor and assume I die today, what hope do my children have? Who takes care of my family? Me getting infected with HIV, Lassa fever, COVID-19, and trying to do my best for the health of the nation, who now takes care of my own?
Okay, we'll see if we'll get answers to those questions when we return from this short break. Do stay with us. We're still looking at the issues. Of course, we'll be speaking with the Minister of Labour and Employment. Do stay with us.
Welcome back. You're still on Newsnight here at Arise News, and we continue our conversation with the president of Nigerian Association of Resident Doctors. They've started their strike. So let's come back to you, Doctor. You gave a little bit of information about the level of hazard that your members are exposed to. Help us understand in terms of finite numbers, those who have been exposed to COVID-19 or any other diseases, because you're saying that only 5,000 naira is paid for hazard.
Especially the COVID hazard allowance.
Yes, hazard allowance.
Thank you very much. Since on the 27th of February, when the first case of COVID was found in Nigeria, we have had over 382 doctors that have been exposed to COVID-19, with about 1,824 confirmed cases and 17 that we have lost. Nurses, pharmacists, lab scientists have also lost many of their members. So we are not just particular about just doctors. We're talking about all health workers. All health workers need to be insured. All health workers deserve better hazard allowance. All health workers deserve better working environment. That is what we are demanding for.
Before we bring in the Minister of Labour, hopefully we can get him in the next few seconds. You talk about fraud within the health institutions, especially on the part of the CMDs, the chief medical directors, as far as the issue of gift miss and all of that is concerned. Do you want to help us understand what that's all about?
We have some members that are on the gift mix platform. And most times when the stories we hear is that there's an embargo on employment. So doctors are employed under the adage of locum and doctors. Locum doctors are paid less than, they're not permanent staffs in the hospital, and they have to be paid by the gift mix platform. Why the other staffs are paid on IPs. They call the gift mix platform a non-regular payment platform. What we found out was that most of the chief medical directors have chosen to keep doctors on the locum side and don't give them employment. And I tell you, that's why when we complain that we are there's shortage of doctors, the part of the blames are there. If you employ them, why don't you pay them? Why do you pay them half of their salaries. Let me go to another part. Yeah. If you know like Absut, you'll be shocked that they have not been paid for 20 months.
That's Abia State, University Teaching Hospital.
Imo State, they have not been paid for 5 months. So how responsible are our governors? It's a big question we need to ask. You can't watch your people suffer, don't get good health care, then you get just malaria, you travel abroad to get treatment. Why your hospitals are left there for over 20 months and nothing is done about them? It's a big shame on them.
So it's not just at the federal level that you're having issues with
it's worse off in the
health
states.
sector.
We have tried to go with the Governors Forum to help us talk to those governors. But as it stands today, they do not care. They feel comfortable being in their government house and do nothing about it. Why for 20 months they have not been paid? And those people cannot even stay a month without being paid.
Let me even bring some of the demands that you've made so that we can get a clearer picture. You're asking for the abolishment of exorbitant bench fees being paid by members on outside postings in all training institutions.
I'll give a big thank you to the Minister of Labour on that. It was agreed yesterday that the bench fee have been abolished, which I thank him very much for. Abolished. Because normally when you go to you're a supra and go to other institutions where you can get training, you are made to pay exorbitant amount of money. I'll put myself as an example. I won't call the name of where I'm training, but however, I was made to pay 480,000 naira to train in that institution. And that means I was denied having a supervisor for my part 2 work because I was not able to afford to pay for my bench fee.
Wow.
There's what they call the Medical Resident Training Fund. The Medical Resident Training Fund was promised to all resident doctors for 2019 and 2020. Of 2020, about 6,800 resident doctors were paid, while 1,703 were not paid. 558 of them were paid in error. As of December last year, we have written to all the ministries, telling them to retrieve the money back to those paid. Doctors are honorable, and they have said, give us an account, we pay into. But it's still all stories. After 4 months, nothing has been done about it.
I'm curious to find out, is this the practice in other parts of the world? Are you talking to your colleagues who have moved to the United Kingdom, Canada, USA? Is this the practice?
I was answered that sincerely. I've thought about it many times. And I wonder if I decide to leave the country, who then to treat my mom and my dad at home? That's the big question I want us to answer. Because when you see the way you have good health insurance, good security system, good free life that you know that you won't be kidnapped tomorrow, you want to go abroad. But being patriotic as we have been, we have stayed to serve Nigeria. And I hope government takes more interest in all health workers and do what they need to do.
So how concerned are you that at the time that you have now decided to go on strike, the president has gone abroad for a health check? What do you have to say about that?
It's painful, shameful, and an embarrassment to the country. If you seek for global best practices outside, you can do it at home. If you invest this money, you invest in medical tourism into the health system here, people want to travel.
Indeed.
So we call on them to be more responsible, to take the health of their nation first, and to go a long way to make Nigeria work well.
But do you think in all sincerity that government alone can actually fix Nigeria's healthcare challenges?
Yes.
Don't you think the private sector needs to play a big role without necessarily opening private hospitals, but joining in partnership with the government, whether it's federal or state government or even local government?
Yes, we have private sectors and federal sectors also, the federal tertiary hospitals and the state teaching hospitals. Of the brunt, the state teaching hospitals have been the one bearing the brunt. Private hospitals help to complement the federal and the state teaching hospitals. If not for some private hospitals, I won't mention names, so it doesn't be an advertising. You cannot do kidney transplants in Nigeria.
Okay, so
if not for them also, You cannot have functional MRIs, functional CT scan, functional radiotherapy.
So if we were to look back at the issue of insurance, just very quickly then because of time. In terms of government emphasizing the national health insurance scheme should be as much as possible mandatory, why have you not gotten them to be able to give you that health insurance for all members of your association?
The National Health Insurance Scheme cannot give you the best of drugs. The drugs they give in the hospitals cannot even buy augmentin. They cannot pay for major surgeries. We have colleagues that have an end-stage kidney failure and needs a transplant. Where do they fall in? They'll tell you it's not covered under your premium. It's like buying cars or insuring your house or car. There are different categories of insurance. What insurance do they give us as health workers? It's a big question I'm asking them. When you cannot help us to do a replacement of kidneys, when you cannot help us to have a total hip replacement, when you cannot help us to do major surgeries. So where do they come in?
So what is the way forward now? Let me ask the same question Kay asked earlier. What will it take for you to get back to work?
I hope that the government, being responsible, should call all health workers and do actions, not memorandum of understanding or memorandum of actions. Put the pen to paper and tell us at so and so time, by Tuesday, all house officers will be paid. By Tuesday, all people in gift mix will be paid. By Tuesday, a percentage of the hazard allowance will be paid. By Tuesday, those that we have lost and died will get at least a check to tell them thank you for your sacrifices done. Thank you.
Thank you very much, Dr. Okhuaihesuyi, NLRD President. Thank you very much for joining us. Hopefully, we go back to work sooner than later.